Oh, I forgot, Paulina. When I hit record, Teams makes everyone consent, and I think you have to reshare. Sorry about that.
Sorry, I just realized I was muted. Okay. So I have to reshare my screen.
Yeah, you hit record and Teams says, okay, now consent to being recorded before you can unmute or share or do anything. So
Got it. Okay, one moment. Let me get my screens back to where they were. So everyone just take a moment and get settled, and we'll start very soon. And in the meantime, feel free to take our demographic survey, which is in the chat. All right. I think I shared my screens correctly. Is everyone seeing? Perfect. I see a thumbs up. Okay. All right. So we are going to get started. Hi, everyone. Welcome to today's community meeting for Lake County Behavioral Health Services, Behavioral Health Services Act. And we're going to kick off our time together. So I'm going to pass it over to Scott for opening remarks, and then we will get started. Go ahead, Scott.
Thanks. Hi, my name is Scott Abbott. I am a program manager here at Lake County Behavioral Health Services over the Behavioral Health Services Act program and housing. And this is our second community meeting for BHSA. We are putting together our 3-year plan for BHSA. BHSA, just real quickly, is what MHSA, the Mental Health Services Act, is becoming starting July 1st. And so we're in the planning stages of making that conversion. So with any conversion, it's always a little bumpy. And this is no exception because BHSA requires a lot more additional pieces to it than MHSA did, including a full integrated plan of the whole department, not just MHSA programs. And so, but it still has, thankfully, a strong, very strong community involvement. And that's why we're having this meeting, have you here to participate. So we're super glad that you're here, that you're taking the time to be here with us today, to share your input, to see what's happening, and to be able to contribute to this community plan. And so we're fortunate that we have some really good folks from RDA here who are helping guiding this process. They are LCBHS consultants. They've been helping us for years and years when we were MHSA, and they're helping us with the conversion. And they got a great presentation here planned. And so I'm going to turn it back over to Paulina. And Paulina, could you introduce your staff as well, just real quick?
Absolutely. Thank you, Scott. Yes. So myself and my colleagues, Julia Owens and Jamie Dorsey, are with RDA Consulting. And as Scott said, RDA Consulting has been partnering with Lake County Behavioral Health Services over the past few years to work on and help them create and develop their 3-year plans and their annual updates that are associated with the Mental Health Services Act. And so now we're partnering again in this transition to the Behavioral Health Services Act. So we're really honored to be here, and we're very excited to continue working with you all. All right. Okay, so Introductions. So we've done our welcome, but we haven't yet done all of our introductions. I know that we have so many people in the room, and it is really hard and difficult for us to do individual introductions with the time that we have. So we do ask that folks put their name, pronouns, and program in the chat. If you aren't affiliated with a particular program, you can just put your role or where you're calling from. I do want to acknowledge that this is a hybrid meeting, and the peer support centers have graciously agreed to host the meeting in person. If the peer support centers are able, feel free to come off mute. We would love to say hello, and we'd love to know how many people you have in attendance. So I see some. I know I see Big Oak. Are there other peer support centers, and does anyone feel comfortable coming off mute and saying hello?
Yes, the harbor on Main is here. We have, let me count, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 attendees.
Amazing. Thank you so much for being here.
Okay, we finally got the mic to work, and we're at Circle of Native Minds. Good morning.
Awesome. Good morning. How many people are there with you in person?
7, 6? 7, including me.
28.
Amazing. Thank you so much, and thank you for working and navigating those technical difficulties. I really appreciate it.
Of course. Thank you.
Awesome. Thank you. We just heard from the harbor, the circle. Do we have Lavos, Big Oak in attending and able to come off mute?
Hey, this is Ken at the Big Oak. We got about 4 or 5 people here.
Awesome. Thank you, Ken, and thank you everyone for being there. All right. I don't know if we have Lavos. I'll wait just another second, but also feel free to use the chat as well. And I'm seeing a lot of people are putting in their introductions, and I really appreciate it. All right. Well, we'll just keep on going. All right, so why are we here today? I think Scott did a really nice overview of why we're here for BHSA, and so a lot of what I'm going to say is a little bit of a repeat. Today is the second community program planning meeting for LCBHS's Behavioral Health Services Act 3-year integrated plan. The BHSA actually replaces the Mental Health Services Act, or MHSA, which was used to fund behavioral health programs in Lake County. BHSA changes how funding can be used, and Lake is working to shift programs and services in a way that meets community needs. And today is one of the many opportunities for the community to come together to learn about BHSA and provide input to inform local program and service delivery. So our objectives for today are to first provide an overview of BHSA to ensure that we all have a shared understanding of the changes that are happening and differences from MHSA. We're going to review the BHSA behavioral health goals. This is something very different from MHSA. We're going to go over their definitions and how Lake County is doing across all of the priority goals. We're also going to present updates from LCBHS programs and services that are currently serving community members. And at the end, we're going to gather your input on the strengths and needs for behavioral health services, as well as ideas for improving community health and wellness. So hopefully, I know our last meeting was a lot of information coming to you. Today, we want to hear from you. So I hope that today is more like a conversation. All right, so here's some quick tips on how to fully engage in today's meeting, with this being a hybrid meeting. So for those that are in person at any of the peer support centers, there will be a coordinator or staff person on site to manage the meeting. And for those joining virtually, it's best to find a quiet, distraction-free location with a strong internet connection. However, as I've also experienced myself, it's really hard to do that. And we're all busy and working and things are happening around us. So please just let us know if we can assist or support you in any way in engaging in our meeting today. Either Jamie, myself, or Julia will be available to assist with any technology needs via chat. We also ask that you all please save any substantial comments, questions, or feedback for the Q&A portions of the meeting. So after each section, we will be pausing for any questions that you have. And at the end of this meeting, we're actually going to have dedicated breakout rooms. So we definitely encourage questions of any kind in the chat, but know that we're going to be using those set times to answer questions. Feel free to raise your hand when it comes time to asking questions, or you can put your questions in the chat, whichever you feel more comfortable with. And if you're in person and you have a question, feel free to physically raise your hand, and your on-site coordinator or staff member will let us know that there's a question, or they can enter it in the chat for you. All right, so how to contribute to the discussion. We talked a little bit about this, but for those online, you can raise your hand by selecting the raise icon at the top of your screen. It has a little hand icon. And then if you're calling in via phone, you can raise your hand technically by pressing *5, and you can unmute yourself using *6. Also, for those online, you can use the chat. And if you have any comments you don't want to share in the meeting, you can send them to Scott Abbott via email, and his email is on the screen. All right. Okay, so if you all joined us at our last meeting, we started this new polling system. So this is called Mentimeter. And you can take this poll by going to menti.com and putting in the code that's at the top of our screen. Also, Julia just dropped into the chat the actual link that will take you directly to the poll. And as you answer, my screen should be updating in real time. I also thought that I had a QR code, but I think I may have accidentally gotten rid of it. So I'm very sorry about that. But if you have any questions, please put those in the chat so that we can assist. So we would love to know, have you been to a previous Lake County MHSA community meeting before? Or is this your first one? We'd love to know who's in the room. Give folks a second to navigate to Mentimeter. I don't think we're seeing any movement. Are folks having any trouble accessing the poll?
I submitted, but it's not coming up on the screen there.
Oh, that is so weird.
I submitted and it's saying, please wait for the presenter to change slides.
Yeah,
Oh, there
So
we go.
There it is.
That was my fault. I didn't change the slide. So here we are. Thank you so much. Awesome. So we have a good number of folks, 21, that have been to one of our meetings before. That is so amazing. We have 9 folks who are new. Perfect. Yeah, thank you, Wendy, Megan, for answering. I'm so sorry for that. That didn't happen last time, but here we are. Okay, anyone else? I think we'll give maybe 10 more seconds. Right. Well, this is great. It's good to know that we have a lot of returning folks, but we also have folks that this is their first time. So welcome. We're so happy that you're here. And thank you for taking time out of your day to be with us today. All right, so we're going to be going into our BHSA education or overview, and I'm actually going to hand it over to my colleague Jamie to present this section and talk through BHSA.
Have to unmute. Thanks, Paulina.
So because we have a packed agenda, we're going to go through this relatively quickly, but I did just want to let everybody know. So we had a community meeting in October where we really went into depth into BHSA and the differences with MHSA and how funding works and all of the new components. So I'm actually going to drop into the chat a link to LCBHS's website where these slides and recordings are if you want more information, because we are going to move through this a little bit more quickly than we have in previous meetings, but want you to have that information if you need it. All right, and going to the next slide.
Also, I just want to add the link to the recording for the October meeting was also in the invitation that was sent out. It was right above the flyer. It's a little link. So in case anybody wants to see that.
Perfect. Thank you so much, Patty. So now we're talking about BHSA, as Scott and Paulina have mentioned, but this is a change from MHSA, which is the Mental Health Services Act. And we're actually in the last year of MHSA. MHSA is going to end June 30th. So what we're doing this year is we're planning for BHSA, which has some similarities from MHSA. It's grown out of MHSA, but it is a little bit different. So MHSA the Mental Health Services Act was passed in 2004. It's commonly called the millionaire's tax. It's a 1% tax on personal income for folks making over $1 million. And this money is used to go towards every county in the state to help support mental health services. And this at the time was really a change in kind of moving funding from like the state to the local level. And it's a predominant funding source for mental health services across the state and within counties. So MHSA currently funds mental health services and programs across 5 component areas. These are listed on the right. The first is community services and supports, and this goes towards services and programs that are serving folks with serious mental illness. There's prevention and early intervention. So as the name implies, this is for services and programs that are helping to prevent or intervene early to prevent the onset or development of serious mental illness. There's innovation, which allows some funding to like test new approaches or new programs. There's also some funding that can be used towards capital facilities and technological needs. This is more like infrastructure needs. And then also for workforce education and training. So as we said, MHSA is being transformed into BHSA, or the Behavioral Health Services Act, as part of Proposition 1, which we'll talk a little bit more about later. But BHSA will go into effect July 1st, 2026. But what we're doing right now is planning for those programs and for those shifts that'll happen as part of the transition to BHSA. So on the next slide, just to give a sense of like the types of programs that are currently being funded under the Mental Health Services Act within Lake County. So under this community services and supports bucket, these are things like the crisis access services, so like the crisis line, mobile crisis, the full service partnership programs, the peer support centers are funded under CSS and PEI, Native American peer counseling, parent partner support, outreach and engagement activities like the street outreach van, also funded under CSS and PEI, the early intervention services, the NEST, older adult outreach and prevention like senior peer counseling or the friendly visitor program, Motherwise, mental health first aid, the prevention mini grants, other suicide prevention programs like Know the Signs or the QPR trainings, if anyone's participated in those. There is currently an innovation project that'll be ending, but this is more towards like the electronic health records and dashboards. There's also some funding that's used towards electronic health records and other infrastructure needs, and then also the county's workforce education and training initiatives. So this is just to get a sense of the types of things that are currently funded under MHSA. So then the next one, so I mentioned the BHSA is part of Proposition 1. There's 2 components to Proposition 1, which we'll talk about on the next slide. But Proposition 1 was, or is, a statute that's intended to kind of modernize the Mental Health Services Act. So realizing that maybe it's not working in the ways that it used to, or that it needs to be updated and modernized. That's what BHSA is and what Proposition 1 is doing. So there's a couple of key priorities. So focusing more on not only folks with serious mental illness, but also folks that have co-occurring homelessness or risk of homelessness or criminal justice involvement. We'll see that there's really an increased emphasis on housing and particularly access to permanent supportive housing and also residential treatment, including and increasing access to substance use disorder treatment and services for folks with co-occurring mental health and substance use needs. And then also to create more transparency in planning, in expenditures, and then also in outcomes. So again, like this goes live officially on July 1st, but we've been planning for it throughout 2025, and that's what these series of meetings and stakeholder activities are. And then the next slide, please. So as mentioned, Proposition 1 has two components. The first is this bond act that is authorizing about $6.5 billion to kind of build or develop behavioral health housing and treatment. So most of this is going to go towards building or developing inpatient and residential treatment beds across the state. And then the other $2 billion is going to go towards permanent supportive housing, including about half of that is going to be earmarked for veterans. The part that most people know of Proposition 1 is this Behavioral Health Services Act. So the first thing it does is rename MHSA to BHSA. And part of that is because it's expanding services to include substance use treatment. So it's not just mental health anymore, it's also behavioral health services and also these housing interventions. The distribution, so those 5 components that we talked about, those are going to change. And there's a new component for housing interventions. Full service partnerships, as mentioned, have always been covered under MHSA, but there's more of an emphasis on full service partnerships and particularly the implementation of evidence-based practices within those FSP programs. There's not going to be dedicated funding at the county level for prevention programs anymore. That's going to shift to the state level. There's always been an annual or a 3-year plan and then annual updates as part of the Mental Health Services Act, but that plan was really dedicated to planning for MHSA funded programs. Now this is shifting into a larger integrated plan, which will actually be kind of detailing the plan for department-wide behavioral health services across the continuum, not just those that are funded by the Behavioral Health Services Act. There's also the statewide behavioral health goals that that Pauline is going to walk us through in a few minutes, that are uniform across the state. So every county needs to report on these same behavioral health goals. But this is also to inform county planning and resource allocation. And then because of this kind of expanded scope of the Behavioral Health Services Act as compared to the Mental Health Services Act, there's also a larger group of community partners that need to be engaged as part of the community planning process. And Carrie, I see your question. Will BHSA support post-release MAT services from the jail? Scott, I don't know, do you want to address that?
I guess I was going to ask, Carrie, what do you mean by that question? I mean, I think the big thing to remember about MHSA and BHSA is it's not designed to supplant existing funding for programs.
Right, that was a question from one of our community members that are here. Did you want to elaborate, Dr. Bob?
Yeah, it's a question from Dr. Bob Bernstein, the Lake County Public Health Officer. One of the 5 components of the National Commission on MAT services for jail is the important community relationship that would take place when an individual is released from the jail having started MAT services. So I would think, or I would hope that BHSA would have funds that would enable the community, like here, the Hilltop or Hillside, I forget what the clinic is called, MCHC clinic, to be able to support post-release services.
Okay.
This is Amber. May I?
Yeah,
add
thank you,
comment?
Amber.
Okay.
Please.
What I can say is that the department as a whole is.
Just real quick, Amber, let me introduce Amber. Amber is our SUDS program manager. She is our expert in this matter. Sorry, Matt, Amber. Go ahead.
Hi, good afternoon. What I want to say is that the department as a whole is exploring multiple funding opportunities to address that need that you're speaking of. What BHSA specifically addressed in the new funding bucket is field-based initiation of MAT services. So that means we will be working on a plan on how to do initiations out in the field. So that can include post-release services from the jail also.
Thank you.
Thank you, Amber. And we'll have some more time for questions at the end as well. And like Paulina said, we'll also have some discussion. So moving on to the next slide. So if you remember those 5 MHSA categories, the CSS, PEI, innovation, WET, and CFTN. So there's different funding buckets now. So there's 3 funding buckets. The first is for full service partnership, and a little over a third goes towards these full service partnership programs. These are wraparound programs kind of that take a whatever it takes model for folks with kind of the most complex needs that are still community based. This is actually similar to what funding would have looked like before, because half of community services and supports had to go to full service partnership. The next bucket is behavioral health services and supports, again, a little over a third, 35%. So this is where kind of other community services and supports outside of full service partnership would be funded, things like early intervention, outreach and engagement. Some of the money can also be used towards workforce education and training, those infrastructure needs, as well as innovation pilots and projects. And then the new bucket is this housing intervention bucket. So about a third needs to go towards housing interventions. And these are specifically for folks that either experiencing serious mental illness or at risk of serious mental illness. And these are for folks that are chronically homeless or at risk at homelessness or experiencing homelessness. And there's all different sorts of housing interventions that this can go towards, like permanent supportive housing, rental subsidies, other kind of supports, outreach and engagement, things to kind of get folks housed and get them into housing. So on the next slide, so there's a lot going on in this slide, and I definitely encourage you to go back to that first community meeting if you want more information where we talked through all of this in depth. This is really just a snapshot to say that there's a lot of Tetris that is happening right now within the county to figure out how the funding for under MHSA, how things can be shifted around to still kind of fund everything under BHSA. And kind of doing that Tetris, doing that mapping to see where things can now fall under these new categories and these new requirements. So I won't go through this in depth, but like some examples are, so right now, full service partnerships have 2 components. They have a service component and also a lot of funding that goes towards housing those folks in full service partnership programs. Previously, that was all funded under MHSA community services and supports. Now the FSP services are going to go into this full service partnership bucket, but the housing is going to go into the housing intervention. There's also several different types of housing services that were funded under MHSA, like the housing coordinator, housing outreach, things like the nest that are going to potentially be moving into housing interventions. The full service partnership. So the peer support centers provide a lot of services, including, and they also serve a lot of FSP clients. So trying to see if some of those services could also potentially be funded under full service partnerships and what that would need to look like. And then kind of any other types of programs falling into this other behavioral health services and supports bucket. So all of this planning is still happening. But also to let you know, there can be some shifting of funds. Up to 7% of funds can be transferred from one component to another. So for example, 7% of housing intervention could be go to other behavioral health services and supports to increase that bucket a little bit. So there's some flexibility. There's a lot of planning that's happening. And this is partly also why we're talking to all of you to understand kind of like what the priorities are and what the needs are and make sure that the funding plan kind of aligns with the community's needs. And I also see, Carrie, your comment about what is meant by BHSA eligibility. So there are eligibility criteria. In the most basic terms, this is folks that are either experiencing or at risk of kind of serious mental illness or substance use disorders. Okay, and then going into the next slide. So as part of MHSA and now BHSA, there's always been a requirement for a community planning process where the community's needs and input is really taken into account when developing these plans to make sure that the plans are responsive to community needs, and that will continue under BHSA. And on the next slide, so this is a list of the community partners that need to be engaged in this process. So obviously folks who are participating in mental health and substance use services, as well as their family members or loved ones, folks who are actually providing these services or staff at those organizations, providers and staff at providing medical or healthcare services, or folks from those organizations, as well as education partners, public safety partners like law enforcement, emergent EMS, firefighters, probation, juvenile justice agencies, social service providers and organizations, folks providing housing and homeless services, also veteran services providers, local government and tribal organizations and representation, and then also labor unions. So really talking to folks kind of across the entire continuum to get different perspectives and different viewpoints of kind of what the county needs. On the next slide, so as mentioned, there's different kind of roles and responsibilities. So the community members, we really want to hear from you, hear your perspectives, hear your lived experiences to inform what the county's needs are, and also to inform strategies. We want your input kind of throughout the whole development of this process. The Behavioral Health Services Department, so LCBHS, is responsible for actually developing the plan and then implementing that plan. The Behavioral Health Advisory Board kind of assures that there is the required community involvement. They also review the plan and provide feedback, and they'll be responsible for conducting the public hearing, which we'll talk a little bit about what that is in a minute. The Board of Supervisors is ultimately responsible for approving the BHSA integrated plan before it can go to the state for approval. And then us, RDA, we're kind of here just to help support this process. We're helping to facilitate these meetings, to also kind of collect and integrate all of this information into the plan. And then on the next slide, so where we are, so we started this process really in the summer of kind of doing some planning, figuring out these community planning meetings and what this process needed to be. Right now, we're in the tail end of the needs assessment. So as mentioned, there was a first community meeting in October. This is the second community meeting. There was a community survey that was launched in November that we also encourage everybody to take to get your feedback that way. We'll also be facilitating focus groups in December and January with a mix of providers and external agencies, as well as some community members. And we'll be identifying themes and needs from all of that input and kind of coming up with a needs assessment. That'll move us into next year. The first 3 months will be really developing this BHSA integrated plan. So in February, we're going to be having another community meeting where we're going to be sharing out the findings from this needs assessment and getting the community's input on strategies and what the county can do to kind of address some of those needs. At the same time, we'll be also drafting this integrated plan. And then this needs to be, a draft of this plan needs to be submitted to the state by March 31st. After that's submitted, we'll do a public comment period where this plan will be posted publicly for anybody to read and review, and we welcome your feedback and your comments and your input. At the end of that 30-day comment period, we'll have a public hearing, again, hosted by the Behavioral Health Board, which is another opportunity for you to provide your input. We'll provide an overview of what the plan is. Then from any comments that we get, we'll make some revisions to the plan or make sure that those comments are addressed, and then present that plan to the Board of Supervisors. And then the final plan needs to be submitted to the state by June 30th. And also during this period, the county, like LCBHS, will also be launching the request for proposals or RFPs for any contracted behavioral health services. All right, next
I would also
slide.
just like to emphasize in Jamie's presentation right there that one of the entities that we will be seeking a lot of feedback from is from behavioral health consumers and their families. Those who receive services, their input is also very significant.
Absolutely. Thank you, Scott. Okay, so then this is a link to the county's BHSA website. There's more information there. There's more links, a lot of resources if you're interested. And then on the next slide,
so I got Ricky Wood over to his thing this morning.
on the next slide, we have additional kind of BHSA resources. So these are more compiled or produced by the state, as well as just the legislation, if that's something that you're interested in going back to the roots of BHSA and kind of reading through that. But here's some additional information and all of the links if you're interested. And again, these slides will be posted on the website after this meeting. And then before we move into the next section, so we're going to do another poll. And I know that this was really fast. Again, encourage you to go back to community meeting 1 if you have more questions. But just want to see from folks kind of a pulse check of how you're feeling about BHSA. If you have a good understanding of BHSA in the community planning process. And feel free to go to, Julia just entered into the chat, the Mentimeter poll link. I think the QR code, unfortunately, is covered by this thing. But it looks like we're getting some responses.
This is also completely anonymous, so just wanted to put that out there as well.
Maybe leave it up for another 30 seconds or so. And thank you everyone for this feedback. We probably don't have time to get into it now, but we do have a feedback form at the end. And if there's something that we could do, if there's resources that we can provide, if you have any ideas about what would help you to feel like you have a better understanding of all of that, we would love your input. And the feedback form is a great place to do that. Or, feel free to talk about it later or email us or email Scott. But we know it's a lot and we appreciate you hanging in there with us. All right, Paulina, you feel ready to close the poll? Oh, still some trickling in.
Yes, yeah, I think I will close it very soon. But appreciate everyone sharing. This is awesome. I feel like we're seeing more people in the agree than we did in the first meeting. So hopefully by kind of repeating this information, letting it sink in, hopefully that is helpful. All right.
And we do have, I'm wondering, Paulina, in the interest of time, do we want to hold questions maybe for later?
Yeah, let's do that. I think if you still have a question and don't want to lose it, please feel free to put it into the chat. and we can respond to it there, but we will have plenty of time in the breakout rooms to also talk through any questions or feedback that you have about BHSA. Okay, well, I think with that, we're going to be going into our last section before we take a break. So a break is coming, we promise. But we have one more section with some really interesting information that's new. So we're going to be doing an overview of the BHSA behavioral health goals. So we introduced these at community meeting 1, and this is the same slide that we shared last time. Essentially, the Department of Healthcare Services identified 14 statewide behavioral health goals focused on improving well-being and decreasing adverse outcomes. The purpose of these goals is to inform state and county planning and prioritizing resources. And the Department of Healthcare Services will continuously assess statewide and county progress toward these goals. And so out of the 14 goals, there's 6 goals bolded in green that are required by counties to address and report on. This is very different from MHSA. There were not goals that counties were required to report on. And so this is new for the Behavioral Health Services Act. So you can see here that goals for improvement are access to care. That is the one required priority goal. So increasing access to care. There's also goals for reduction. So reducing homelessness, reducing institutionalization, which we'll talk about the definitions of all these very soon, decreasing justice involvement, decreasing removal of children from the home, and reducing the untreated behavioral health conditions. In addition to those 6 required goals, counties must choose an additional goal from the list. So all the ones that are not bolded, Lake County has the opportunity to select at least one that they would like to report on and address over the next 3 years. So today we're going to review how Lake County is performing compared to the state average across the 6 priority goals that are bolded. We're going to go through each one individually, one by one. And we ask just everyone to hold any questions until the end of this section or when we have our breakout room discussions. Okay, so first we're going to talk about increasing access to care. So the definition is making it easier for community members to find, schedule, and use healthcare services that are right for them. What's really great is that the Department of Healthcare Services actually provided us data that shows how Lake County is performing compared to the California state average. And so we're going to talk through how Lake County is performing. So compared to the statewide rate in Lake County, there is a higher access to services among adults with mild or moderate mental health needs, but there's slightly lower access to services among adults needing intensive or severe mental health and substance use services, and also lower service access for children and youth. So you'll see also I'm kind of using a color coding pattern where something in green is something more ideal or positive, and red means that this outcome is maybe not as ideal or negative. Homelessness. So this is one of those goals that we want to reduce. The definition is connecting unhoused individuals with mental health and substance use challenges to treatment and resources for their overall health and for safe and stable housing to support recovery. Compared to the statewide rate, in Lake County, there is a higher rate of people experiencing homelessness. There is a higher rate of people with serious mental illness or substance use disorders experiencing homelessness. And there is a lower rate of people experiencing homelessness using local housing and support services offered through the county's continuum of care. And continuum of care, or COC, as you may have heard it be called, is a local group in your county that coordinates housing and services to help people who are homeless or who are at risk of homelessness. Institutionalization. The definition of this goal is helping people get the mental health and substance use support they need while living in the community so that they don't have to spend as much time in the hospital or a treatment center. And compared to the statewide rate in Lake County, there is a higher rate of adults and youth accessing crisis intervention services and a slightly lower rate of adults accessing crisis stabilization services. So we talk about crisis services with institutionalization because access to crisis services is meant to reduce the need for institutionalization or reduce the need for folks to enter the hospital or treatment center. I also want to call out that data for most of the measures related to this this goal of institutionalization was actually missing for Lake County. So we don't have as much to share for this one. Justice involvement. So the goal is to reduce the number of individuals living with mental health and substance use challenges who are involved in the justice system. So compared to the statewide average in Lake County, there is a lower rate of youth or juveniles arrested, but there's a higher rate of adults arrested compared to the statewide average. And there's also a higher rate of adults returning to jail or prison after being released. So recidivism, if you've heard that word, there's a higher rate. Removal of children from the home. So the goal is to prevent children from being removed from their home due to abuse or neglect. Compared to the statewide rate, in Lake County, there is a higher rate of children in foster care, a higher rate of confirmed child abuse or neglect cases, and a lower service access among children with an open child welfare case needing intensive or severe mental health and substance use services. So I'll kind of leave this for a second. I know this is a lot of information, and these slides are available. We also have these slides available in Spanish, and so they should be on the Lake County website if you want to return to these later. And lastly, untreated behavioral health conditions. So the goal is to reduce the number of people with untreated mental health or substance use needs by connecting them to care quickly and effectively. And compared to the statewide average in Lake County, there is a higher amount of people who are getting follow-up care after going to the emergency room after or for substance use. And there's also a higher amount of adults receiving care for mental health or drug issues when they need it. So those are very positive. But there is a lower amount of people who are getting follow-up care after going to the emergency room for mental illness. And some of these goals may be connected, where maybe that's also something connected to institutionalization as well. So you might be seeing some weaving across these goals. Okay. I know that was a lot of information, so I want to pause and just see if anyone had any questions about the data that we just talked through, or any questions or needing any clarification on these goals.
I think what these goals show us is we have a lot of work to do.
Okay, I see Kimberly, you have your hand raised.
Yeah, just curious, when you mentioned there was less utilization of the COC housing initiatives, is that like, I thought all of our shelters were pretty consistently full. Can you clarify what was meant or what was intended to be shared in, for that topic?
That is a great question. I don't know if Amber, you have an answer to that, or if someone would like to speak on the housing or COC side. I'll go back to that slide so we can take a look. So Kimberly is referring to this last bullet point, that there is a lower rate of people experiencing homelessness that are using services offered through the COC. And her question is, there are a lot of people using the shelters, so why may we be seeing this in the data?
My comment is not specific to the continuum of care, but I just wanted to highlight that the data that was used for these goals are from 2022, and we have done a lot of work around homelessness and substance use access since 2022. So some of the data is a little bit older.
That is a great flag. Thank you, Amber. Yes, this data is the most recent that the state had available.
And I'm also not sure where they're collecting that data. I'll have to look at it further.
Mm-hmm. Yeah, we can follow up with the data source.
I would assume some of it would be from HMIS, the Home Management Information Services, which does a lot of self-report. As far as people identifying as having serious mental illness or substance use disorder. So it might be a little bit a part of it too.
Thank you, Scott. I also see Melissa Koff. I know you are very within the COC realm, so would love for you to also chime in as well.
Yeah, I'd like to speak to this. If we are discussing 2022 data, then that would be around the time that our Lakeport shelter closed down for several months. So that could explain, it's one possible explanation why there would be a higher percentage of individuals experiencing homelessness or unhoused versus the number of people accessing services. And if we're talking about 2022 data, like what has already been said, there's a lot of initiatives that have come into place since the 2022 data. I mean, that was 3 years ago. And we have come a long way as far as being a continuum. And so I think that really diving into the state data and looking at where it's coming from may end up helping if we want more answers on what exactly they're referring to with this.
That's Absolutely. A good point. I forgot about the shelter closing in 2022. Yeah.
Absolutely. Yeah, this context is extremely helpful in just understanding what this data might mean and where there might be limitations to this data. I'm going to pass it over to Carrie or the circle. I see that your hand is up. Feel free to come off mute.
Hey, we have Dr. Bob has a question.
Yeah, thank you. So slide 29 on the removal of children from home. Just curious, is there anything specifically in the BHSA Act on support for ACEs related services, adverse childhood experience related services?
That's a measure that I think that they are using as an outcome in determining, how we're doing in this area.
Yeah, I feel I need to also look more into how the funding can be used and how ACEs related services are a part of that, because I don't think I can speak to that right now. I'm not sure. Thank you for your question, though. We will take that back.
We have a hand up.
Oh, yes, Denise. Sorry, I missed that.
Good morning. Yeah, I know this is I'm working with the older adult population, but I worked in CPS for years. And I was just wondering when I saw this, it's just so sad. I was wondering, does Lake County have a wraparound program? Do you guys engage in the wraparound program? Because if you look at the statistics on wraparound, it really lowers the rate of removal from families.
Pass that over to you, Scott.
I was going to ask if Kimberly would have anything to say about that.
Yes, RCS does operate a wraparound program. We are currently working with the state to make improvements to this program based on the new Fidelity wraparound standards. I also know that Lake County Office of Education does a wrap light or wrap like program, but yes, we do. We have operated this program in Lake County for, I don't know the exact date, but over a decade. So yes, we do offer wraparound services.
Thanks, Kim.
Thank you, Kim. Okay, we're going to do one more
Thank you.
question. Perfect. We're going to do one more question. I see Bonnie's hand. Feel free to come off mute.
Okay, now I'm unmuted. I wanted to just remind all of us that this is data that is in comparison to the state average, right?
Right.
Correct.
So if we're looking at I'm sorry, I don't have it in front of me, a higher rate or a lower rate, it's that again, if the business of having the shelter closed, I don't think and the data points that you talked about are not what we need to be looking at. We need to say, yes, we don't have enough shelters to accommodate people. It's not that they weren't full because the shelters were, I mean, we need more shelters in order to be up to the average. Am I right?
More shelters to be up to the average.
Average in the state.
As
If we
far
don't
as
have enough shelters for people who need it, we can't even approximate the average for the state, I would
right,
think.
we can always use more shelters. We can always use more transitional housing. We can also use more permanent housing. There's definitely a housing need in our community. It's statewide,
Right,
but
exactly.
it also exists very strongly in our community as well.
Yes, but I think that I'm sorry, I'm confused. I'm going to stop talking now. Thank you.
No, Bonnie, that was so helpful. And I think that the answer, I think, is a part of the answer is increasing beds, but there's also probably a lot of other strategies too to increase these numbers and get closer to the statewide average. And so that actually kind of leads us into our breakout discussions that we'll be having at the end, where we want to hear from everyone. How can we improve what we're seeing in these numbers, or how can we improve the outcomes of community members? So you're right on target, Bonnie, because we will want to hear from the community on that. We do have to move forward for our timing, but I know I just saw a hand come up from the circle. If this is a quick question, we can absolutely address this one. So feel free to come off mute.
Hi, this is Carrie. I just wanted to point out that Samantha Bond put a very good explanation of, childhood trauma and ACEs into the chat if anybody wants to read it. So that's all I had.
Thank you, Carrie. Yes, I invite everyone to look into the chat for Samantha's message that talks about ACEs and other uses of BHSA funding. Thank you. All right. Let me move us. So now we're a little behind schedule, but I think we're still okay. We're going to take a 5-minute break for folks to just go grab water, go to the restroom, whatever you need, and then we're going to come back together at around 11:05. And so, yeah, and let us know if you need anything, and we'll see you then. All right, we're going to be coming back together in the next 30 to 45 seconds. So feel free to navigate back to your seat if you got up, and we'll get started very shortly. All right. We're going to jump right back in to our second half of the meeting. And we're going to be moving into program updates and hearing from programs in Lake County that are currently serving the community and addressing some of these behavioral health goals that we just went through. This section of the meeting is really meant to highlight all of the amazing work that's happening in Lake County, and also showing you all the types of services that are currently available in Lake County across mental health, substance use, and housing. All right, so our main
Just to add to that real quick, you know, when or build on what you just said there, Pauline, is I think it's important, you know, as we're doing planning, is that the community understand what is already happening and what we're trying to do, so that you can be informed in your feedback and suggestions of, you know, what needs to be still done.
Absolutely. This ties to the breakout rooms and the discussions we'll be having. So giving context of what's already being offered and maybe what may be missing or what we need more of. Thank you, Scott. All right. So we have some folks that will be presenting today, and we actually asked ahead of time that these folks will answer these 4 questions. What types of services do your programs provide? What is one success your programs accomplished in the last year? What was one of the biggest challenges your programs encountered in the last year? And how do your programs address one of the behavioral health goals? And remember, those were access to care, justice involvement, institutionalization, and others. Okay, so I'm actually going to pass it over to Alicia to kick us off with Lake County internal programs, specifically full service partnership, early intervention, and general programs.
Hi, good morning, everybody. I'm just going to start off. I'm Alicia, by the way. I'm going to start off with our full service program, our partnership. And that really provides intensive community-based wraparound mental health services to adults with severe and persistent mental illness who are at high risk for hospitalizations and homelessness or justice involvement. Services could include case management, crisis intervention, medication support, psychotherapy, housing assistance, benefits advocacy, life skills. So it's real wraparound. The services are individualized to the person, they're recovery orientated. One of the accomplishments from the full service partnership program last year is that we were able to help multiple high acuity clients transition from repeated psychiatric hospitalizations and homelessness into stable housing, and while maintaining engagement for outpatient mental health services. We go back to that big challenge of affordable housing. So one of the challenges was finding appropriate housing, especially for these high acuity cases. And so it kind of slowed us down in placing people. And it supports the goal of reducing institutionalization. And I would also put up there that it reduces maybe justice involvement too. early intervention programs, they kind of focus on early identification of psychosis before it gets too far gone. And the studies show if we focus on early involvement, like the first psychosis, etc., that it has a better outcome for folks and actually decreasing full-blown psychosis later on in life. We have also our adult programs. Justice Involved, our Justice Involved program has grown very rapidly. So that's our mental health diversion court, our CARE Act, folks on probation also. And one really success that we just recently experienced is we had someone involved with our mental health diversion court for 18 months. He graduated last week, and before being involved with this team, he never lived independently. So he's learned life skills, has housing, lives independently now, and he had a small misdemeanor that was then able to be expunged from his record. And then we have our transitional age youth team where we really focus on folks between the ages of 16 and 25.
All right. Anything else, Alicia, that you would like to add to this slide, or anyone involved with these programs? All right. Thank you so much. All right. Thank you. So we are going to move on to other internal programs, specifically the peer support centers and outreach. I actually asked if Carrie is able to speak to these, if Carrie is available. Is Carrie at the circle?
We can come back to that.
Okay, we'll come back to this one. So we'll move into prevention. And this one is going to be Kendra. Is Kendra on the call?
Kendra is on the call.
Yay.
Good morning, everybody. I'm sorry, my camera, I've been trying to work with my camera, so I'm sorry, video is struggling this morning. My laptop's trying to do some updates, so I apologize in advance for that. The joys of technology some days. So you can see, well, first of all, let me just say I'm Kendra Boyce. I supervise the BHSA outreach and prevention team. Some of the services that we do provide include outreach and connection activities, access and referrals for our older adult population through our Connections program with Denise Schrady. We also have school-based services for students 5th grade through 12th grade. That includes suicide prevention, education, self-awareness groups, mental health wellness, bullying prevention, and teen mental health first aid. We also provide mental health first aid training, QPR, education, which is question, persuade, and refer for adult populations, including educators, law enforcement, medical staff, local tribes, and even our behavioral health staff. When we talk about mental health first aid, we're just talking about looking at signs and symptoms and other strategies to help those who work within, whether it's an adult population or those who work with youth or high school students themselves working peer-to-peer. We also offer small group outreach at our local centers, partner agencies, even local businesses who like to have those small groups like art expression, whole body wellness, mental health wellness. Some other things that we also offer are our small groups for students and adults through our local tribes that include mentoring, talking circles, Native American Club, Wolf Pack, and other like activities that Haley Palua really does a great job with outreach and connection with them. We also have our mini grant program, and this program provides community-based providers and consumers and family groups with one-time funding that help conduct those prevention activities and projects within our local community. And then, of course, we also do the resource and information through our local community events, whether it's LCBHS hosting or partnering with other agencies and tabling to outreach to the community in that way as well. One of our successes for our programs, not only our connections program for our older adult, but our other one really is for establishing our bullying prevention education, which is brand new for this fiscal year particularly. And we're actually starting to get into the elementary schools with that program through Tina Ransberg. And then one of the biggest challenges I say this year was actually trying to establish that and just getting the schools to recognize how important that it is for mental health, that program itself. And then how do these programs address behavioral health goals? Well, we know that there's many myths about suicide, and those who might be dealing with mental health challenges, right, that really add to the stigma of it. And we know that our program provides mental health wellness training and support along with suicide prevention education to help aid in that reduction of stigma surrounding mental health and suicide. That's what I have for that.
Amazing. Thank you, Kendra.
You're welcome.
I do see a question from Richie in the chat. Are there any programs in the works or services? I'm assuming this is related to prevention, and don't know if you have anything you'd like to say, Kendra.
Yes, we do have other things that we are working on, reaching out to our LGBTQ community as well as our Spanish-speaking community through outreach and prevention. Right now, we are in that planning stage, getting connected to other agencies with certain programs that we'll be collaborating on as well. So there's more to come, absolutely. Thank you for the reminder, Richie.
Amazing. Thank you, Richie, for the question. And thank you, Kendra, for that wonderful overview of all the prevention programs that are happening in Lake County. These are wonderful. I'm now going to actually go back to the previous slide for peer support centers and outreach. It looks like Carrie, you are available, so I'll pass it over to you.
Hi, everybody. Carrie Manning, and I am the supervising behavioral health clinical specialist, and I supervise our peer support centers and our outreach services. I'm just going to briefly go through our peer support centers are kind of like the first stop for a lot of our folks within the community. Many of them know where we are and what we do. And a lot of people utilize our services, between 20 and 60 a day at each one of our centers will utilize our programs. So at the centers, we collaborate with community partners if they want to, we have recently partnered with Tribal Health for a diabetic prevention support group. And I believe that that's like a 12-week program, and they utilized our community room here at the Circle for that. That's just one of the many things that we do. social services as well as Catholic Charities come into the centers to provide assistance to our peers with applying for benefits, food stamps, cash aid. We also have in-home support that comes in to, help people get connected with becoming an IHSS worker or getting IHSS services. Each one of our centers now have food pantries where the community can come in and get non-perishable foods. And, we collaborate with the community with that. We recently had someone stop by and she had gone to Costco and brought in pasta sauce, breakfast stuff. Just, it was amazing. Each one of our centers does food giveaways in collaboration with Lake County Helping Hand. And we do that twice a month over at the Big Oak Peer Support Center, and then once a month at both the Circle of Native Minds as well as LaBose. Each center has clothing closets, and we try to have blankets, heavy sweatshirts, jackets, anything, for our peers to help keep them warm. Each one of our centers are access points for coordinated entry so that our people experiencing that are unsheltered or unhoused or that do not have stable living environment can get connected with the HMIS program and the hub for assistance in finding housing. Each one of the centers is a linkage to community agency services like shelters, mental health and substance treatment, food banks, ID vouchers, the mobile crisis response team, and also as well as record expungement. We've worked with Lake County Probation on keeping people in compliance with their probation by, linking them with their probation officer. A couple of our centers have had iPads in the past where people could actually attend their probation meetings with their probation officer. With our street outreach, our street outreach this year has kind of changed a little bit to where we're not as focused on giving out items as we are with connecting people to services and getting them entered into coordinated entry. But one thing that we've started new is transporting people to food banks as needed, as well as taking them to the shower trailer. The Big Oak Peer Support Center, they're fortunate because we partner with Adventist Health and we provide a shower trailer there with a hot meal once a week on Tuesdays from 11 to 3. But that's the only center that they've, been able to have the appropriate equipment to host it. So at the Circle of Native Minds, we give people rides to Kelseyville to go to that shower on Thursdays. And so we're really grateful that we're able to do that. And I'm open to questions, or if I forgot something, somebody chime in.
Did you want to mention about the FSP that we're supporting now?
Oh, I have a question here.
This is a terrific program, I think. My question is, and I apologize for coming back to this because I'm involved in preparing for MAT implementation at the jail. So my question is there a way to train peers who are released from the jail with MAT services, having had introduction to MAT services, and then out of the jail, is there a good possibility for a peer program for them?
We could definitely talk later because the peer support, the state peer support training is open to anybody. So I'm more than happy to talk about that. I think that's a great idea. So, yeah. Any other questions? Did I forget something? Oh, Kendra.
Yeah, Kendra, feel free to come off mute.
It's not so much a question. I just know that I need to talk about something else. And so I just want to make sure I raise my hand.
No problem. Yeah, feel free. Go ahead, Carrie. Sorry.
Yeah.
Is there any more questions about the peer support centers or outreach?
I was just gonna mention that there's family support.
Oh, God, I'm so sorry.
I'm not
Oh,
Edgar.
geez.
I'm not Edgar. I'm Wendy because I'm running around the Peer Center today to help out. But family support, Wendy Gattoni. I am the parent partner. I am housed at LaVos, but I am kind of a separate entity. But I support families, meet them where they're at. I connect them to services, transport them. I am part of a RAP occasionally. Once in a while when I get invited by another agency. I support the children's team for behavioral health services, making sure the families are, understanding the process and all that. And IEP, FSP supports in schools, and just a lot of support for families. And also doing the HMIS intake for families that are unhoused, which we have quite a few of right now. That's about it. Just wanted to add that on. Thank you.
Thank you, Wendy.
Yeah, sure.
Thank you so much. Anything else related to peer support centers or outreach before we move over to Kendra?
Kim wants, there's one of our centers that I cannot talk about. It's the Harbor on Main, which is ran by Redwood Community Services. So I don't know, Kim, do you want to come off mute?
We actually have we have a separate slide.
Oh, okay. All right.
Thank you.
You're
No,
welcome.
thank you. All right, we'll move over to Kendra before we go over to Kim. So Kendra, feel free.
All righty, thank you. I've just been designated to talk about a couple of other programs that I don't oversee or anything, but just to give a brief overview. And then if there's anybody who else can add to that, that's great. I know that the Canocti Senior Supports have a couple of programs that we need to mention. There's senior peer counseling, which recruits and trains seniors to be peer counselors for seniors over 55 years of age. We know for those who are in Lake County and are homebound, isolated, and may suffer from mild anxiety or depression, they offer peer counseling services between two people, right, who share common age, which is really nice, and common experiences. I know that this program helps create access and linkage to services as each referred client is professionally screened to determine, right, the appropriateness for the program. And this program also improves timely access and services as the clients receive like an intake interview by the program manager as soon as possible by telephone. And then this program helps reduce the stigma and discrimination of mental illness as one of the peer counselors is able to respond, right, with their knowledge, right, in helping. They don't diagnose or create treatment plans, but they assist the client in creating goals, right, that can be reassessed. So that's what they do through their senior peer counseling, and as well as their friendly visitor program. This is a program that recruits and trains volunteers to visit those isolated seniors. So again, their target population is the homebound and isolated, and their volunteers provide companionship and life enrichment with activities like heart-to-heart talks, walks, shared hobbies. And so I know that they also do a lot of community outreach activities through Vet Connect events, mental health fairs, community radio, and such as well. So those are those. And then also I've been asked to talk a little bit about the Motherwise program. And the purpose of the Motherwise is to provide respectful, judgment-free support, information, and resources to pregnant and perinatal mothers and caregivers in Lake County so that maternal mental health issues, right, are destigmatized and all aspects of motherhood are honored. They do that through community engagement with, that includes things like their donation closet, a car seat program, community events. And they also have peer support, right? That includes in-person support groups, virtual support groups, check-ins, and other special events, right? That include their Wave of Light and the Angel Tree. I don't know if there's anybody on here maybe that can jump on and talk about Motherwise maybe a little bit more, or anything else to add to that.
Thank you, Kendra. I'll pause, see if there's anyone that wants to jump in before we go to our next slide.
I don't know how to do this. Okay, so we have someone here that is actually works with one of those programs.
Right, I'm from Canasta Senior Support. I'm Rebecca with the Friendly Visitors Program. I just really want to put a plug in for keeping the funding for older adult outreach because we are 30% of the population of Lake County, and most of the people that we reach out to are not technically sophisticated and can't access some of these surveys and ways of letting the community know that they need us. They're quietly miserable. They're not causing a big problem, but we're all going to be there someday. So please think about this. 30% of our population of Lake County. Thank you.
Thank you so much. All right. I think we're going to move forward. I also see Samantha Bond just put into the chat some services that Motherwise provides, in-person peer support groups, monthly gatherings for pregnant mothers and caregivers of children 0 to 5 and their support systems, virtual peer support, online peer support for mothers only, mom-to-mom closet, donated maternity, baby, and children items, car seat program. I think Kendra spoke a little bit about that. Awareness raising through social media and disseminating information about maternal mental health issues. The Auntie Network, trained volunteer companions that provide in-home supports to mothers who accept this service. And screening and referrals. So Motherwise utilizes the Edinburgh Perinatal Diagnostic Screening Tool to screen mothers. And special events as well. So hosting occasional events to increase awareness of and reduce stigma surrounding, I just lost that. Surrounding, I think that is postpartum depression, OCD, bipolar disorder, and anxiety. Samantha, do you have anything else that you would like to add? Feel free to come off mute. Or put it in the chat.
Yeah, so most of the work, I think it's already been mentioned, is around perinatal mood and anxiety disorders. And those are just some of the services that they cover. And some of it is actually in partnership with First Five as well.
Awesome. Thank you for clarifying. Thank you for clarifying the acronym PMAD, perinatal mood and anxiety disorders. Thank you. All right. I also want to lift up Carrie's comment that they now have lived experience radio show on KPFZ Wednesday at 2 p.m. They provide information about community events, resources, and recovery topics. All right, so I'm going to now move into Redwood Community Services. So I invite Kimberly to present this slide and talk about the harbor, the nest, and other services that RCS provides.
Okay, good morning, everyone. We'll go ahead and give a start with the harbor. So the Harbor on Main is a drop-in center that provides comprehensive skill building and empowerment services for transition-aged youth, 15 to 24 roughly. We offer services to meet acute needs, so that could be food, clothing, including gender affirming clothing options, hygiene supplies, and referrals to community-based services. We are an access point for the coordinated entry services or coordinated entry system. In addition to that, we provide very focused services and supports to the LGBT population and some SUDS prevention services. Additionally, we also have certified peer support services offered throughout the center, which improves access and to timely care and treatment. One of our proudest accomplishments has been the engagement with some of our local schools and our school districts. In fact, the superintendent of Lakeport Unified has recognized that that our school-based staff has shifted the culture at Lake Terrace Middle School regarding staff perspective on mental illness. And I know there's been collaboration with Lake County Behavioral Health to get some services on site, and we're really proud of that connection. Through those connections, we've seen an increase in youth accessing the harbor. And it's just been really something we're really proud to share. And in general, the services offered at the harbor align closely with, and in many cases directly support the majority of the behavioral health goals that were shared earlier. So for the purpose of this report, we wanted to highlight access to care as the key area of strength. Youth who visit the harbor benefit from immediate access to a wide range of support groups and on-site services, facilitated both by certified peer support specialists and trained non-certified peer staff. This timely youth-centered approach reduces barriers and ensures that individuals can receive help when they need it the most. Regarding the NEST, so the NEST stands for Nurturing Education and Skills Training. It is a family stabilization program, or I think now we're calling it something else, and I apologize for not recording that. Also designed to provide temporary housing for transition age youth 18 to 25 and their children 0 to 5. We are pleased and we very appreciate that some of our NEST participants are here in the room with us today. They're quite fun to watch as they're playing around, so I hope you got to see the videos. So participants play an active role in developing and implementing their individualized program plans. Through guided coaching and hands-on learning, they gain essential skills such as budgeting, saving towards self-sufficiency, positive and healthy parenting, meal planning, etc. During the last calendar year, NEST served 12 mothers, 1 father, and 14 children. And of the families who exited program, 8 successfully transitioned into safe and stable housing, demonstrating the program's meaningful impact on promoting long-term family well-being and stability. We do want to highlight, and I know we discussed this briefly in the last BHSA meeting, but one of the biggest challenges that affects NEST participants is the transition of therapeutic services when a participant reaches the age of 26. So under the current specialty mental health contract between RCS and County BHS, services must be transitioned to County BHS or another provider once a participant reaches this age. This can really disrupt the continuity of care for the individuals and potentially impacting their progress and well-being. And while we understand that there are people in this meeting who very much support the idea of being able to maintain those services and continuity of care, it's not that easy. And so that's this ongoing struggle that really impacts some of our clients. Just as they're starting to feel stabilized and supported, they are having to transition into a new provider, and that can be really disruptive to the treatment. And so that is just one of those challenges that we see. And yeah, I think that is it, unless there's any questions.
Thank you, Kimberly. It's amazing to hear all the great work that you all are doing over there at the harbor and the NEST. So thank you so much. All right, we're going to move on to our next set of programs. I'm going to be passing it to Amber Westfall to be speaking on substance use disorder services, both internal and contracted services. So Amber, feel free to come off mute whenever you're ready.
Thank you, Paulina. Good afternoon, everybody. Amber Westfall, Programs Manager for Lake County Behavioral Health Services, Substance Use Disorder Services and Programs. I will be talking about our internal and contracted services that we provide specific to substance use disorder services. Firstly, I want to share that behavioral health operates the Drug Medi-Cal Organized Delivery System, also known as DMC-ODS. For all of Lake County Medi-Cal members, DMC-ODS is an expanded treatment benefit covering costs of drug treatment services for Medi-Cal members. Lake County Behavioral Health Services operate as the managed care entity responsible for organizing and overseeing substance use disorder treatment services for all eligible Medi-Cal members in Lake County. Under a DMC-ODS system, covered services for substance use disorder services, there are an array, and I just want to reiterate that these covered services are paid for by Medi-Cal. So some of those services that are covered under the Medi-Cal benefit include early intervention and education services, outpatient treatment services, intensive outpatient treatment services, residential treatment, and embedded in those modalities I just mentioned are also perinatal services. Withdrawal management, also known as detox, is a covered benefit. Narcotic treatment program, MAT, medications for addiction treatment, peer support services, recovery services, care coordination services, and mobile crisis services. Internally, under the Lake County Behavioral Health umbrella, programs that we provide are early intervention and education services. We have an outpatient program. We also have an MAT program. We offer recovery services, care coordination, and mobile crisis services. Outside of the Medi-Cal benefit, we also have a DUI program that we offer, and outreach and prevention services specific to substances for youth in school-based and community settings. And we also offer a 24/7 member access line for anybody who is interested in engaging in substance use services or would like just a little bit more information on how to access those. Additional contracted services that we offer are outpatient services, intensive outpatient services, residential services, withdrawal management services, perinatal services included, and what's not on here but is also a contracted benefit is narcotic treatment services. So we have a mix of internal and contracted services that we provide in the county. A few of our contracted providers I see are on the call today. So we have Hilltop Recovery Services and Redwood Community Services who offer outpatient, intensive outpatient, residential, and RCS offers perinatal services for Lake County members. One of the biggest successes that our program has accomplished in the last year is opting into the Drug Medi-Cal Organized Delivery System plan. This was achieved and we went live July 1st, 2024. Previous to that, Lake County was considered what is called a Drug Medi-Cal state plan. Under that model, Medi-Cal only paid for outpatient services, including perinatal and perinatal residential services. So opting in to an organized delivery system really expanded the amount of benefits that became available to Lake County members. One of the largest challenges that we've faced over the last year has been having enough provider capacity and workforce. We are a rural county And all of the services that are covered are not available in Lake County, although we do have RCS and Hilltop Recovery Services, who are amazing providers, and they also serve other people regionally. So I'm really proud to have them inside Lake County. And so some of our contracted providers for these covered services, our members have to go out of county. So that can be challenging in terms of transportation and other reasons. Another large challenge is the lack of youth residential services. And that's not unique to Lake County. That's a regional and state problem. However, you know, Lake County, we are focused on doing what we can to get some youth residential services that are covered under Medi-Cal for our members. There are several private pay youth residential programs, but those are just out of reach for a large amount of our population. Another question that I was asked to address is how our programs address one of the behavioral health goals. So a goal for improvement, being in the DMC ODS model, we are improving our access to care. So we've expanded the amount of services that are covered to Medi-Cal beneficiary, and we have also lifted up a 24/7 access line that we never had previous to DMC ODS. A goal for reduction that we are meeting is untreated behavioral health conditions. So now with the expanded covered benefit, drug Medi-Cal members now have greater access to residential treatment and withdrawal management services that address untreated substance use behavioral health conditions.
Amazing. Thank you so much, Amber. That was wonderful. All right. I'm going to move on to our last group of programs, and I'm going to be passing it to Scott to speak on Lake County Behavioral Health Housing Services.
Okay, before I jump into that, I just also wanted to add that in addition to the contracted providers that we've mentioned, including Kim talking about RCS and Amber talking about some of the other ones that we use for substance abuse services, we also contract with some out-of-county providers in providing behavioral health treatment, residential treatment. And internally, we contract with the Lake Office of Education for providing therapy services in schools, which is great. And also we contract with some individual therapists in the community as well. And we also partner with Partnership Health Plan, which is our managed care, Lake County's managed care company for Medi-Cal. And so we work together in coordinating behavioral health care for our community members on Medi-Cal. So I just wanted to add that those are also key important components of our department. Moving on to housing services. As we talked about earlier, housing has gained a greater importance in the Behavioral Health Services Act. Jamie mentioned how it now represents 30% of what our funding should be going towards. The nice thing about that is that we provide, we've traditionally provided housing through our full service partnership program previously. We provided a lot of housing, including motel stays for getting people with behavioral health issues who are in need, who are homeless, and as well as supplementing people's clients' rent in the community so so that they can can continue staying in housing. So we've already been doing this as an agency, been doing a lot with that. We've also received some different grants from the state, such as the Behavioral Health Bridge Housing Grant, which we are using to help folks that don't meet FSP criteria for housing, but have behavioral health needs. And we also utilize the Homeless Housing Assistance Program grant funding for the county that comes to the county, and we use that to in coordination with the Lake County Continuum of Care, which also receives their own COC homeless I call it HHAP, Homeless Housing Assistance Program. So we combine funds to utilize to help the homeless in our community. As it says right there on the slide, one of the key things that LCBH does is we are the administrative entity for the Lake County COC, which we discovered is really unusual. I think we'd only been able to determine that we are the only behavioral health that is the administrative entity for the COC. COCs are required. Let me explain what a COC is real quick. Continuum of care. The continuums of cares are what is required by HUD, the Federal Housing Urban Development Department, that how they distribute HUD funds, HUD federal funds. And states also use the COCs to distribute funds as well. And so what COCs are is they are a collaborative of different interested entities and individuals in each community, mostly in each county, in helping to address homelessness through grants and so forth. So most shelters and housing developments, not at least transitional housing developments, are probably usually get their funding through local COCs. And as I mentioned, behavioral health is the COC administrative entity, meaning that we there's a board that runs the COC, and we follow the directions of the board to help make things happen, including helping writing for grants, run our homeless management information system, which is the software that records the data around the folks that are homeless and being placed, and tracking them and helping them. It also funds our coordinated entry system, which Carrie talked about briefly, being an access point. All the peer support centers are access points for the coordinated entry system. And we also do the point in time count, which is coming up next month, which is a once a year count of all the homeless in the community. And so we have, as a result of that, LCBHS has been very, very tied into homelessness services in our community. And obviously this addresses the goal of reducing homelessness. It goes without saying. But it is an important feature within our department, recognizing that being homeless is very traumatic, very affects behavioral health in a very negative way. And if we don't address homelessness, we're not going to be able to fully help folks that are homeless and dealing with behavioral health issues. So which is one of the reasons I believe the state pushed the idea of BHSA of addressing homelessness more, recognizing it's a problem here in California particularly, and that there is such an overlap between behavioral health and homelessness. And so a lot of our resources are dedicated to that. We've done a lot of, as Melissa mentioned earlier in our webinar here, done a lot of growth and development of trying to address homelessness. We have a really good COC board. We have a great many staff that spend a lot of their time doing outreach to those that are homeless, as Carrie mentioned, working with folks that are need housing, as Rachel, one of our staff here, does, helping build permanent housing, such as Hollison's Place in Nice and Bevan's Court Apartments over in Lakeport. So a lot of effort goes into addressing these programs. Any questions about that? Kind of rambled there for a little bit, but if you have any questions, please feel free to ask.
Absolutely. Thank you so much, Scott. Yeah, we welcome any questions. We also welcome, if you would prefer, you can email Scott directly. So I'll pause just for a moment. All right, if there are no questions, I think we're going to move into our next section and last section of this meeting, where we want to hear from all of you. And so this is a time for community feedback, community discussion, and hearing from you all, your perspectives on services, strengths, challenges, and needs. So what we're going to do is we're going to break into 3 groups. So I actually asked Patty to set up those rooms. We're going to have three rooms, and it looks like there's a little over 30 people. So we're going to have approximately 10 people per group. It'll be random. Each breakout group will discuss needs and strategies with a focus on these priority behavioral health goals. And if you forgot what they are, we can also drop them in the chat as well. And we also have some discussion questions. If you are at a peer support center, you have the option to host your own breakout room where you'll be muted and you can talk amongst yourselves, or you can join in on the virtual conversation. So once we go into breakout rooms, we ask that the coordinators on site just let us know what your preference is. If you want to provide input on the needs or strategies for the behavioral health goals beyond what there is time for in your breakout room, you can send all or any feedback to Scott Abbott via email, and his email is on the screen. All right, so as a preview, what we'll be talking about together are these points. So we want to know, based on all the information that you received today and what was shared and your knowledge and experiences, firstly, which existing programs and services, we just talked through so many of them, which of these programs and services are the most helpful in addressing mental health and substance use? Are there ways that these programs or services could be improved? What challenges do people face when trying to get mental health or substance use support? And are there groups or populations that are being left out or facing more challenges? And then based on those challenges, what could Lake County and partners do to better support people with behavioral health needs? And we can also throw in these discussion questions in the chat as well, if that is helpful.
Please.
All right, awesome.
I'm setting up the rooms. Sorry.
No, oh my gosh, take your time, no problem. I'm going to stop sharing so that we can all see each other.
I really
Perfect.
want to make sure there's a meeting organizer, in each room, and it's taking me a minute. So.
No worries. Yes, if possible, having myself, Julia, and Jamie in different rooms would be perfect, but we can also hop between rooms.
Okay, so I am going to, oh, this is just, do we want a time limit on the, there's too many options in here.
Well, we are going to come back together at 12:25, if that's helpful. So about 25 minutes.
Okay, let's go do that. It wants all this information, so. Okay. Okay, sorry, I don't think I've done breakout rooms on Teams before. This is different.
That is okay.
So. Okay, all right, I think I got it. Everyone's assigned to rooms, so I'm going to open the rooms now.
Perfect. Thank you, Patty.
Sure. And hopefully, I'm going to stay here just in case something goes wrong, but hopefully everyone's in the right rooms. All right, there you guys go.
Thank you, Patty, so much. All right, so if you're able, there is a little button at the top that should have just appeared that says join room. See you all soon.
Jamie, did you not get in there? What happened?
I don't see a thing that says join room.
What the heck? I don't even see you on here. Hold on, let me find you. Why won't it won't let me select your name?
Weird.
This person can't access breakout rooms. I don't know why, but apparently you can't do the breakout rooms. Why is that? Hold
Why?
on. Let me just see what. Are you in the Microsoft Teams app or?
Yeah.
Oh, someone came back in.
Oops,
Henry.
yeah, I accidentally closed out the meeting. I actually hit the wrong key for the window. It's like, oops.
Oh, that's okay.
It,
Do you remember which room you were in? I think it
no,
was room 3.
I don't remember. It happened so fast.
It's okay. I'll get you in. All right. There you go.
Thank you.
I don't know what's up.
Patty, I don't know what's going on. Here, let me leave and I'll try rejoining and let's see if that changes. I don't know why this is happening. If not, though,
Okay.
so let me leave and come back and see if that helps.
Okay.
Okay, I'm back in.
Okay, let's see. Well, this is so weird. I'm getting chats from all 3 breakout rooms.
Are they like,
Okay.
where is our person?
No, they're just, it's like they're talking to each other.
How weird.
And it still says you can't access breakout rooms. That is so bizarre. You're a co-host. I don't understand.
Can you, okay, let's not worry about it. Can you break out the 3rd breakout room and put them into Paulina and Julia's rooms? And I'll just message them on the side and say that for some reason I can't be put into a breakout room.
Yeah, let them know.
Yeah.
Let me just, okay, Julie's in room 1. And okay, I think it's room 2.
So weird. And I'm gonna like Google and see what's going on. I don't know what, but I'll chat them and just let them know that I'm.
Okay, let's see if I can give them a warning that I'm going to move them to a different room.
So weird.
Okay, So I gotta move everyone from room 2. Okay. Geez, can I do that? Actually, I don't know if it'll let me do that without closing the room. Like, if I close the room, what happens?
If you close the room, do you think they'll come back here and then you can reassign them?
They're moving back here. Okay, sorry everybody. I have to put you in the other rooms. Sorry about that. Okay. Where?
Oh wait, we could do it here.
Oh yeah, we could just do it in here. Go ahead and I'll just mute myself and be here for
Okay.
tech support. Sorry.
No, it's okay. Hi everyone, can you hear me?
Yes, we can hear you.
Okay.
Jamie.
For some reason, Patty was like, I wasn't allowed to be assigned to a breakout room. So I don't know what happened. We'll figure that out later. Teams, I guess, doesn't like me today. But so that's why we closed my breakout room and now we're all just in the main room, which is also fine.
Well, good. So are you here acting as the lead?
Yes.
Perfect. Okay.
Yeah. So I apologize if you all were just sitting in a room alone with nobody.
We got started. Denise was sharing some of her thoughts around the first question. And what was kind of identified was a need to increase like some more intensive like case management, care coordination wraparound to assist people, and in Denise's case, the older adult population, from like the moment of engagement and followed through to their first service, because people are kind of getting lost and falling between the cracks there.
Okay. I'm just taking notes on what you just said. And was this in response to like how existing programs could be improved?
Yes.
Okay. Any other kind of conversation? Thank you so much too for getting this going. Any other, like, did you guys talk about anything else?
That's all we got before you came in.
Okay, thank you. So are there other programs that you all think are like particularly helpful that you'd want to highlight? Or like aspects of those programs that you find to be particularly helpful that would be useful to think about in other programs?
I think what Denise brought up is actually would be useful for programs across the board. We have access points to existing behavioral health and substance use disorder services, but like those nuanced, hey, let's make sure you have transportation. Hey, let's make sure you can remember your appointment to get you there. Hey, if you have a really hard time coming in person, is telehealth a better option for you? Do you have reliable phone or Wi-Fi service? If not, how can we connect you to those to help people be like really successful when they're ready to reach out and engage in services?
Mm-hmm. Absolutely. Just taking notes.
And definitely addressing the callbacks, after the referral, the connection from whatever agency back to the client.
Mm-hmm.
To even acknowledge, hey, we got your referral, and make an assessment appointment or whatever needs to be done.
Mm-hmm. When you say that, is there like a specific
behavioral health has been the one that we were referring to, but I've also had like alcohol and drug, and like I was saying earlier before you came in the room, I don't necessarily think it's one lies in one party or the other. because sometimes my clients, like it'll take a minute and my clients will give up quickly because they're the older adult population and they do, you know, and I'm not by any means categorizing, but there is a significant impatience that comes along, you know, if they're not heard from, to take into accountability with the older adult population, for example, that they're literally sitting by the phone waiting, you know? So timing, I think, time management on that would be a good thing to look at.
Yeah, that's great. And I think that goes back to what Amber, what you were saying of just like when somebody's ready, really pulling out all the stops to kind of make sure that they can get connected and have that follow up and aren't just kind of like looking into the void, not knowing what's happening. Are there other things that you can think of, you know, strengths that you would want to leverage or other ways that you think programs or services could be improved? Especially when we think about like, you know, these statewide goals of like improve. I think what you both were speaking to like definitely speaks to like access to care, but also thinking about like homelessness, institutionalization, justice involvement, removal of children from the home, untreated behavioral health conditions.
I just wanted to thank Amber because she brought up a really good point, and I don't want to keep going, but is, you know, do they have internet and can they access in their home? Because a lot of the people I work with are isolating and lonely, but there's not too many of them that don't have internet. They may have a hard time like getting around on it or whatever, but I could even like aid them in that, you know, as for like their first appointment or whatever, just to show them how to get in or whatever. So that was really good. Thank you, Amber.
I'm speaking on behalf of the Adventist Health Clear Lake Community Health Programs. They were not able to attend today, so I'm just going to share some notes that they provided me to report back. So yeah, same kind of concerns that Denise shared with just like improved coordination within Lake County Behavioral Health Services is requested. They're just sharing that oftentimes, you know, patients or clients are left or lost to follow up. There's also an emphasis for trauma-informed care. They shared here that there's a genuine misunderstanding of what that is, and patients are often treated as if they are the problem when attempting to get help. There's also little to no follow-up for post-psychiatric hospitalization discharge. Most of the people are left to just figure it out on their own, and they're unhoused, have no cell phone or income. Or unaware of when their next appointment is. There's also, yeah, just some concerns with like, seems like there's a miscommunication within the multiple departments within Lake County Behavioral Health. Oftentimes, the different departments don't communicate with one another, so they don't have any idea of what's happening with some of the clients or patients that are referred. So there's a lot of bouncing around. So that's just some of the feedback that that team wanted to share today.
Yeah, great. Thank you for sharing that. So just to recap, so similar concerns with care coordination, clients being lost to follow up, trauma-informed care, misunderstanding what that is, and I think you said like, and clients maybe being blamed.
Yes.
Okay.
Or feeling like they're treated as if they're the problem rather than receiving that trauma-informed care over the phone or when they're trying to get help. They're not treated, I guess, respectfully.
Okay, that's really helpful.
And when Lake County Behavioral Health is called out to do an assessment, they're often asked only 2 questions. Are you going to hurt yourself or someone else? And there is no collaboration with the patient or team on what might support this individual. So it's just 2 basic 5150 questions, and then it seems like that's kind of all that they're left with.
I've received that a lot too.
When you say collaboration with the team, who are you referring to?
It sounds, and I'm just reading from their notes. It sounds
Yeah.
like it's just the teams within Lake County Behavioral Health. So when our members are trying, or when our, associates are trying to work with the patient to get them connected, or even if the patient or client is trying to work with Lake County Behavioral Health themselves, they are disregarded. They're not asked about their mental health history, the current services that they're receiving.
Mm-hmm.
So just a lack of support, I think, for individuals is the general consensus from that comment.
And it sounds like, and again, I apologize because I know that you're reading comments from other people, but it sounds like what you're hearing, and Denise, I think you chimed in as well of like, this is maybe something that you're hearing, but it sounds like maybe when you're calling like is it the crisis team? And they're really just they're just kind of trying to assess if you meet 5150 criteria and aren't necessarily
I'm
trying to see what
not
other support.
focusing on any one group. For me, it's just, I'm just going to say it, not to promote it, but it's basic mental health first aid. You know, not just saying, are you going to harm yourself or others, but, you know, I love the way Melissa put it, was like, you know, what services are you in? And, you know, just to get a round picture of it rather than just making that person feel like, not feel like the victim, you know, to feel that you're here to help, like supported, I guess is the word.
Great, thank you. Does anyone else have anything that they want to kind of contribute or share around these kind of themes?
Well, I can just, I just want to speak briefly on the theme that we've been discussing, and then I kind of want to transition. But I think that sometimes being present in the moment is lost. People are showing up and they're looking at the criteria and the needs for what they're trying to accomplish. And sometimes there's a lack of pause to kind of explain what's going on and like what meets criteria and what doesn't. And so I try to be mindful of that in my interactions, because what I've also seen from a community perspective is there needs to be more like community education and time for that type of detailing, because sometimes there's a misconception of what certain programs and departments are required to do versus and what they're able to do versus kind of what community perception is. And I think if we pause and we kind of take the time to have those conversations and that kind of community education, then I think that there can be some more understanding and increased communication and collaboration around those areas.
Yeah. I love that. And I appreciate you sharing that, because I feel like we do hear a lot about like, you know, we need to educate the community, but I feel like what I'm hearing you say is more like in the moment, not just in meetings like this, but more like in the moment in talking with someone, kind of providing more of that personal touch, more of that kind of explanation of what's happening, what you can do, what you can't do, and kind of like expectation setting. That's super helpful. Okay.
But I think an area that I think that deserves also some discussion is homelessness. I think, shelter and housing is a basic human need, right? And without that, people cannot kind of focus on their substance use or their behavioral health conditions because they're so worried about how they are going to stay dry or warm or have something to eat, right? So when we address homelessness and food insecurity, we're kind of already naturally helping people be successful in addressing other needs. I mean, over the last 10 years, you know, Lake County has lost so many homes due to fires that it's becoming increasingly more difficult and competitive for individuals who do not have SUDS or behavioral health condition to access and find housing, that it's become even more complicated for individuals who are. So we do need more shelter. We do need more transitional housing, but the infrastructure is not readily available, even with some increased funding coming into the community to meet that need. So, like, how do we get people to invest in our community and build, you know, infrastructure perhaps that can be utilized by county and other nonprofit agencies to kind of help meet some of those emergency housing and transitional housing needs.
Mm-hmm. Mm-hmm. Great. Thank you for that.
And as you know, as a county, we can't necessarily buy real property. So like, how can we partner with somebody who can, right? And then work with us to meet those needs.
Mm-hmm. Yeah. And that's a good segue too of, you know, like what populations in particular are being left out or facing more challenges. And I think like the homelessness and housing, you know, hearing that, also hearing like the older adult population, are there other, and I feel like we've talked a lot about challenges of people just like getting access, but are there other challenges that you see in access or other groups or populations in particular that you feel like are being left out or facing more challenges or, you know, require some extra support or just more support in general?
So I might be a little biased here, but what I will say is there has been a really large push for individuals with co-occurring conditions to have services wrapped around them. And there's already a lot of kind of existing services for individuals with behavioral health conditions. But I think the population in the community that are only experiencing substance use issues, there's a lack of access that is made available to other populations.
Sorry, so let me read.
Housing.
So
housing is probably the biggest one.
Okay. So let me make sure that I want to make sure I'm capturing this. So it's like, so I think what I hear what you're saying is that there's like a lot of emphasis on people with co-occurring mental health and substance use disorders, but maybe there are some folks that only have substance use disorders that are kind of being left behind, like that they also need housing and these other supports that right now are maybe more available for people with mental health or co-occurring.
Yeah.
Okay. Great. Thank you for that. And you're not biased, you're speaking from your experience, which is why we want people from all different walks of life to kind of share their experiences. Anything else that other folks want to share when you think about like populations or groups that are in like particular need? Or are there other challenges that you see that you want to highlight?
I hate to keep coming in. Another one is like emergency placement, you know. I recently have had a couple of older adults that were in harmful situations where I had to make an APS report, and we just have no funding or anything for like placing them in a safe motel. I actually got them placed, but it was through other different things that I just personally knew about that I did. So that was only another one that is like really hard to get somebody in a safe place immediately.
Great, thank you so much. And it looks like everyone else is joining back into the main group. We will end there. Paulina, I don't know if you're back in here yet.
I am, just jumped back in.
Okay, sorry. We had to hold our group in the main group because I couldn't be put into a breakout room for some reason.
Sorry about that. Well, that worked. No problem.
Yeah.
Yes, sorry to cut conversation short. I know that was a short amount of time. All right. I think folks are in the room.
I was gonna say, is everyone back? It looks like it.
Thank you, Patty, for coordinating those rooms. I think that was very smooth and a beautiful
For first
job.
time. Next time we'll do a little bit of experimentation in a separate meeting so we know how it works.
Yes. No, it was great. Okay, I'm going to share my screen one last time and we'll close out. Okay. All right, so we're going to close out with some next steps to keep folks up to date on what we have going. So right now we have a community survey that is live and I encourage everyone to take it. We have a slide after this with more information, but that's out now and we'll close on the 19th of December. We're currently doing focus groups and interviews with many different groups throughout the rest of this month and then at the beginning of January. We'll be talking to the Managed Care Plan, Partnership Health Plan of California. We'll be talking with youth. We'll be talking with older adults. We'll be talking to participants at the peer support centers, providers. We have a lot coming up. We also have our third community meeting in February of 2026 next year. We're also going to be hard at work developing the integrated plan to submit a draft by March, the end of March, March 31st, and then we're going to submit the final in June. As I was saying, we have our community survey that we invite everyone to take. And I think Julia will be popping that in the chat. Oh, she's already done it. Perfect. Please use the survey to provide more feedback if you didn't have a chance to fully express all of your thoughts in the breakout rooms. We have many different types of questions and we invite everyone to participate and have their voice heard. And before we close, Scott, do you have any closing remarks or anything you'd like to say?
Yes, I do. I just want to again thank everyone for being here. I know today was a just particularly long meeting. Our second meeting usually is because we have the program descriptions and reports. This one was 2.5 hours, so that's a big commitment. And we really appreciate you being here. Your feedback given is going to be very, very helpful and will be incorporated in the next idea. The next meeting we're going to be taking all the information that's been gathered through these last two meetings and to the focus groups and particularly the survey, which is before you here, and be able to provide kind of an analysis of that of the information that we've gathered. And we use that to hopefully inspire you to maybe give a little bit more feedback based on what you hear, what's been found. So that will be our kind of our next step. So we'll be looking forward to that, and we look forward to you coming back. And I particularly just want to say thank you again for not only just being here, but for your concern about our community, concern about those that are in need, concern about making our community a better place. Really appreciate that, and I appreciate your dedication for doing that. Thank you.
Excuse me, Scott. I just took a picture of the thing
QR
on the
code.
screen. Yeah, and it says this survey closed on February 28th, 2023 is
Yes.
what it's saying.
No, I thank you, Denise. Someone also said that in the chat. This was actually the old QR code, and I deeply apologize. We did not update it. So please use the link on the screen, and it's also in the chat.
Could we get the new one emailed to us?
Absolutely, yes.
Thank you.
I will be sending out the recording from today's meeting this afternoon, and I can include the link and the QR code and all of that stuff in that email that I'll be sending out before the end of the day.
Thank you so much.
We also have links on our website to it as well.
And Patty, if you could, it was requested that the paper copy be mailed out. I mean, especially for our older adults, because a lot of them do not have access to, like the virtual woohoo, stuff. So Rebecca from the Friendly Visitor Program actually requested some printed out copies. So maybe include the copy of the survey that can be printed out.
Yeah, I can do that. I'll send it as an attachment.
Okay, awesome. Thank you.
Okay.
Great ideas. Thank you so much, Patty.
No problem.
Yeah. All right. I apologize again about the QR code. That was totally on me. So I will fix that and we'll get it out to you. And echoing Scott's sentiments, thank you so much for being here. Thank you for your time, your experiences, your perspective. We're really honored to be here, and just thank you for your time. And I think with that,
Thank
One
you,
last thing.
everyone. Thank you.
Oh, go ahead, Jamie. Sorry.
One last thing, if you are printing out a version, like and giving them to your folks, can you just make sure to collect them and either email Patty or Scott, and we'll figure out a way to get those, because we want to make sure that we're getting those responses.
Can also, if there's no other way, you can leave paper copies either at the Clear Lake Behavioral Health Office or at one of the peer support centers, and they can make sure I get them. They can scan them and send them to me too. There's lots of ways we can get them back, so we'll just figure it out as we go.
Thank you.
I'm going to stop the recording now.
All right, Monty.